So with our COVID-19 patients, CPT, anything that generates coughing, pulmonary toilet, anything that generates a lot of different coughings is usually not recommended. But there may be a time when we have to use them, so there's a way to do it safely. Okay, so let's look at this, our Flutter valve. This is an Aerobika, and typically, patient blows through it, exhales here, generates a cough. Okay, we're going to make it a little bit safer by putting this filter on. Now, it'll offer some protection, but there's still coughing, okay? But this offers some protection, and make sure it's used in a negative pressure room. And all caregivers have airborne precautions. Easy PAP is also not recommended, okay? But there's a way that we can do this safer. The way that this works is we have our patient breathe against his resistance. But what we could do with this is we could take our filter and put it here. It's a little bit more safe. So we have our filter in line with our Easy PAP and filter in line with our Aerobika. So with our COVID-19 patients, non-invasive positive pressure ventilation is not recommended just because of the risk that causes. So here's our typical setup for a BIPAP. So a BIPAP mask. It's a closed mask, so there's no holes in the mask, but the hole is in the circuit. Okay, so when the patient breathes, everything comes out of this little hole. So we're going to take our filter, HEPA filter, put it in line right in front of that hole. Okay, so when we exhale now, it's filtered. Okay. Now these are made for breathing, but they may cause a little bit of resistance with this mask. But you'll just have to titrate accordingly, okay? But this is the best way to protect everyone in the room. BVM, not recommended for COVID-19 patients, okay? Why? Because we're ventilating and then we're causing droplets, okay? From the exhalation here in the PEEP valve, or if you don't have a PEEP valve, it's just gonna come out there. So what are we gonna do with this to make it safer? If we do have to use this, filter. Put another filter in line. Put it right in front of the mask, and we have a filter there. If we have an intubated patient, same thing, we're going to put it in line. What about ventilator circuits? Now, thankfully, most ICU ventilators have a closed system, and whatever is exhaled from the patient is filtered from the room air. Now, that's not so with travel vents like the LTV 1200 or the Rebel. Here's an LTV 1200 circuit. This is a vent that's commonly used in ERs everywhere, and transport teams. The exhalation port is here, and that's to room air. Whatever they're exhaling is going to room air right there. So how do we protect us from that? For this, we're going to use an HME HEPA filter combo. This is one of those heat moisture exchangers. It creates humidity for the patient, but it also doubles as a filter. Make sure that you're using a filter that's rated as a bacterial viral filter when you're going to use it in this way. If you don't have something like this, you can always put just a regular HEPA filter there too. Okay? And this will protect everyone from this. Okay? So, for our intubated patient, we make sure that we have our HEPA filter in line in front of the exhalation port. So here we have a Vortran vent. This is a typical disaster recovery vent. And there's a way to filter this, and you just put it just over here, and it'll protect our patient that way. Okay, what precautions should we take when we're intubating a patient with COVID-19? We want to take strict airborne precautions. We want to prevent droplets, so we're going to use low flow oxygen. So our patient is on cannula. We're going to avoid using the ambu bag. Very important note, there's different kinds of ambu bags. If you happen to have one that has a built-in filter, you're lucky because you don't need to take extra precautions. Our built-in filter is right there. But this one does not, so I'm going to actually have to put a filter in line. Okay, and so this one's the one we're going to use for our intubation, we have our PEEP valve, and we also have our Untitled connector inline, so we're just no fumbling. Okay, so we want to do this in one try, no fumbling. We have everything ready. We have our ET tube. We have our ambu bag, even though we're not supposed to bag, we just always have it. We have our ET tube holder. We have our blade ready to go, and we have our ventilator circuit ready to go to put them on the vent as soon as we do it. And then we're going to use a barrier. Okay. Hopefully you can find something better than this. I just took the bag that the ambu bag came in, and I cut it to the side and on the bottom, and I made this plastic barrier. Okay, and so what we're going to do is we're going to do everything under this barrier. And you'll notice I have pieces of tape pre-cut, okay, because you'll see what I'm going to do with those too. Okay, so you notice I have all my PPE on. I have my face shield. I have a gown. I have an N95 mask. Or CAPR or PAPR, okay? I also have a contact gown on, I have gloves. So we want to be very protected. We want to make sure that everyone that's helping you has the same precautions. And we want to limit the personnel in the room. We don't need 10 RTs, 10 nurses, okay? One nurse, one RT, pharmacist, doctor, okay? We want to limit exposure in this room. Okay, ready? All right, we have all the personnel, we have all the equipment ready. We have our patient under the barrier, okay? I'm going to do my best. I'm going to take that sticker, I'm going to put it where it's not obscuring my view, but I want to do everything under this barrier, okay? Of course, we're not bagging, okay? If we need to hyperoxygenate this person, we'll use a non-breather, but we're going to try to avoid any kind of bagging in this scenario, okay? So we push the sedation, we push the paralytic, and our patient looks like they're ready to try to intubate, okay? And you notice I have my barrier, but I don't want this flopping around. So I'm going to take those pieces of tape that I had, and I'm going to make a barrier and then attach it to my intubation arm. So tape, one piece of tape there, one piece of tape here, and I'm going to make this X so it's not going anywhere. Okay, and then I have another piece of tape, just cause. And we have our intubation arm and our barrier. Okay. So I'm going to do everything under this barrier so I can see through it. So I'm going to go in, I'm going to look for my cord, and under the barrier, I'm going to intubate my patient. Remove starlet under the barrier, fill my cup, and move back under the barrier. Bilateral breath sounds. And from here, I'm going to take my vent circuit and I'm going to place it on the patient under the barrier. So from there, we have our patient in a closed system, so we're pretty safe. We're going to take our barrier, and then we could safely put on our ET tube holder and secure the tube. I hope this video was helpful. Thank you for watching. Use your filters. Be safe.